want to talk about a very important initiative? Thank you. Or else I was ready to get the chief and the OPP officers out here. Anyways, my name is Mike Colle, MPP, and the MPP for Eglinton Lawrence. And I have been involved with the volunteers on the ground with sickle cell for a number of years through my local police force, basically. That's how I came to be involved with it. And there's a dynamic group of police officers and community leaders in the Eglinton-Dufferin area, and they support a camp for children with sickle cell, Camp Jamoko. Brendan McCauley, Ojo, Don Moreland, there's a whole group of people that for years have been raising money to send kids for a little bit of a break in the summertime from the debilitating consequences of sickle cell. So this year I had the honor to take on a very important initiative. As you heard earlier, there are many gaps with our healthcare system. And you certainly...
Poor guy, man. Stay up, bro. I would come switch you, but I don't know. For a bit, I don't know, maybe later.
And just for 2 minutes. I asked for 2 minutes
What time is it?
for the children that are suffering from sickle cell.
Yeah.
Adults, as Dr. Turnbull said, people are suffering unnecessarily. And we can do something about it. And I hope you take on Dr. Turnbull's call to action. That we just had a federal election and no one talked about the mess of our healthcare system. All I talked about were jails and jets. Anyways, I presented a small part of the solution as a private member's bill in Ontario. As you know, healthcare is primarily delivered by the provincial governments in this country. The budget of healthcare is half of the provincial budget, about $50 billion every year. So I'm trying to get a piece of that $50 billion for better, more comprehensive care for sickle cell disease and thalassemia. So I have presented a private member's bill, a law that was initiated by Kirsty Duncan, who did the same thing federally, but the federal government does not deliver health care. The province delivers health care. So luckily in Ontario, we have the most comprehensive program of newborn screening. And thank God to the work of people like John Adams and others, one of the genetic diseases that is screened early on now is sickle cell. That's an amazing breakthrough. We also have some of the most exceptional doctors in the world at sick kids and at Toronto General Hospital that are doing pioneering work, exemplary work in fighting the fight to ensure sickle cell and thalassemia are dealt with, but they need help. So what I've done is I've put forth a bill which basically mirrors what we have in Ontario, which is a world-leading concept. You've probably heard of Cancer Care Ontario. It is the umbrella organization that deals with cancer research, cancer funding, cancer care, right across the spectrum, from hospital to doctors to pharmaceuticals. I have proposed that we establish the same umbrella organization comprehensively to connect all the hospitals, all the caregivers, all the medical schools under an umbrella so that we can treat sickle cell and thalassemia and related diseases comprehensively. That is my Bill 165. thalassemia, I did a complimentary thing this week, which was broadcast right across Canada. You may have heard about it. Part of the problem with sickle cell disease is that it's in the shadows, it doesn't get the attention, and there's discrimination involved. So I've asked also for the amendment to the Ontario Human Rights Code, where you cannot discriminate on the basis of your genetic characteristics. That takes place right now. In Canada, you can deny a person employment, you can deny a person insurance, you can deny a person a mortgage because they have a genetic disease. I'm trying to change that because one of those genetic diseases is sickle cell. So, but I need your help. I need your help to make this initiative of creating the Sickle Cell Thalassemia Care Ontario umbrella a reality. Change, as Dr. Turnbull said, does not happen easily. But you can be the agents of change. Just like George Marcello, who's walked all across this country to do awareness about organ transplants. He's also helping on sickle cell disease awareness. One man, George, stand up. George. One guy, one man can make an amazing difference. He even went to Arizona by himself to deal with the horrible situations taking place in Arizona right now in terms of people with diseases and already waiting for organ transplant. Anyway, I ask you to be agents of change. I ask you to join with the great doctors at Sick Kids, the great doctors at Toronto General, with our hospitals, with SCAGO that is here, by being part of a movement to get sickle cell disease out of the shadows and onto the top of the medical health agenda. So I have petitions that you can bring to work, you can bring to school, you can bring to the police station, you can bring to the hospital. Wherever you are, you can do your small part. So I have petitions I'll be handing out later in support of this initiative to bring more attention to sickle cell, more resources, and thalassemia. And so please try and get those filled out, send them back to me. And please, as Dr. Turnbull said, we have got a situation in Canada with such a wealthy, wonderful country, but there are huge gaps in providing for people who suffer in pain, without support, and they wait and wait and wait for health care, which should be there, and it's not there, but it's our job to be the voice of those who cannot speak for themselves. Again, these are the petitions I have. Please join me in ensuring that we make this change happen. And I'm sure we will. I'm confident that we will. And I'm confident because I know the dedication that's in this room. I know of the ability of the people in this room. And as Hillary Clinton said, and it's so true, it takes a village to raise a child. It also takes a village to heal a child. Join me in making sure we create this village to help these children so our children will not have to suffer like many of our adults have unnecessarily by victim of this horrible disease that is unnecessary and unreasonable. So please, let's make this change happen. Thank you for listening to me. Remember, Bill 165, it can make it happen. We need that care. We need that concentration. We need those resources. We need awareness, education. We need passion. Thank you very much.